Hi, Dr. Vinash here. Let's talk about the second category of potassium sparing diuretics, which include Ameloride and Triamterene. These are actually sodium channel inhibitors. Both these drugs block the aldosterone induced sodium channel. Now, I hope you already remember that when sodium comes in, potassium goes out or hydrogen goes out. So, just by looking at this one particular chart and knowing whatever I taught in the first video, you will realize that when you give triamterene or amiloride, the sodium excretion will increase. Now Na plus excretion increases, so something minus also has to go. So chloride will go or bicarbonate will go, and bicarbonate is alkaline, right? So alkaline urine will be formed. Potassium and hydrogen will not be lost. So there is a small risk of hyperkalemia and acidosis. Okay, so the idea is to save the potassium by inhibiting sodium channels. Now, the collecting duct also has this mechanism by which H plus is thrown out when you take in Na plus. The idea is very simple. When Na plus comes inside the epithelium, a positive charge comes inside the epithelium, the lumen will have less positive charge, right? Let us call this intraluminal negativity. The collecting duct has a H plus ATPase pump that is driven by this intraluminal negativity. So when sodium comes in, the lumen becomes negative. Because of that negativity, H plus ATPase pump works and throw hydrogen out into the lumen. That's the concept. Now if you don't take in sodium, there will be no intraluminal negativity, right? So H plus will not be secreted. So both H plus and K plus remain back in the blood. If H plus remains back, it causes acidosis. You always use this drug with other diuretics. Both these drugs elevate plasma digoxin levels, so you have to be very careful when giving this drug to patients of CCMP. There are only two drugs here, triamterene and amiloride. The salient features that you need to know of amiloride is 10 times more potent as compared to triamterene. It inhibits sodium reabsorption at proximal tubule, and it also decreases calcium excretion and increases uric acid excretion. Also, it blocks entry of lithium. Okay, now what happens is diabetes insipidus happens in people who are taking lithium. By giving amiloride, lithium cannot come back using the sodium channels. Lithium is also 1 plus, sodium is also 1 plus. So sometimes the pump picks up lithium instead of sodium. By blocking that channel, lithium cannot reabsorb itself. So kidney does not reabsorb lithium, lithium concentration falls, and diabetes insipidus induced by lithium is mitigated. Surprisingly, we have found a very unique benefit of this particular drug given in the form of aerosol. This drug actually liquefies the secretion in cases of cystic fibrosis. So we can use this in cystic fibrosis also. The side effects are kind of infrequent: nausea, dizziness, a little diarrhea, headaches can happen. Triamterene can even cause muscle cramps. Both these drugs are known to rise blood urea level. Some people have said that triamterene also impairs glucose tolerance and has photosensitivity. So these are important side effects that you can remember. Easy. Now this is a very simple answer. I hope you have understood this properly. If there's any doubt, feel free to ask. I will be more than happy to help. This is Dr. Avinash signing off for now. I will see you in my next session. Till then, take care. Keep rocking. Bye.